What is BLS? BLS stands for Basic Life Support. Basic life support is a support that we have to give to any victim who becomes unresponsive after experiencing a cardiac arrest. The first thing that has to be done whenever we start BLS is to move the victim to a place of safety. Then immediately you have to check for the responsiveness. To check for responsiveness, you have to tap on the shoulder of the victim and shout loudly to check for the responsiveness. Once you find the patient is unresponsive, you must activate the emergency response system and call for help. Then we must check for the pulse. To check pulse, we must check for carotid pulse because carotid pulse is a large central pulse. It can be easily felt and it is very close to the heart. When you are checking for pulse, do not waste more than 10 seconds to check for a pulse. If you do not find pulse within 10 seconds, you presume the pulse is absent. Once the pulse is not felt, we must start chest compressions immediately. When we start chest compressions, we must locate the right place to compress the chest, that is 2 cm above the sternum. When you deliver chest compressions, it has to be delivered at a rate of 100 compressions per minute and up to a depth of 5 to 6 centimeters. The outcome of CPR depends on the quality of CPR done. So, we must deliver high quality CPR, which means the hand should be rightly placed, the rate should be up to 100 per minute, the depth of 5 to 6 centimeters should be maintained, there must be minimal interruptions between the chest compressions, and adequate time must be given for the chest to recoil. Chest compressions must be delivered in a ratio of 30:2. That is, for every 30 chest compressions, you must deliver 2 rescue breaths. In 2 minutes of time, we must complete 5 cycles of 30:2. After completion of 30 compressions, we must deliver 2 rescue breaths. When you deliver rescue breaths, you must open the airway. The technique by which we open the airway is called as head tilt and a chin lift. After opening the airway, we must deliver 2 rescue breaths. Each rescue breath must be given over a period of 1 second. We must observe for an adequate chest rise while delivering rescue breaths. Chest compressions and rescue breathing must be given alternatively for 5 cycles in a period of 2 minutes. Meanwhile, AED arrives. What is an AED? AED is an automated external defibrillator. After the pads are connected to the victim's chest, within few seconds the AED will analyze the rhythm that is running inside the victim's heart. If the AED identifies a shockable rhythm, it will immediately deliver shock and abort the underlying arrhythmia. The most common shockable rhythms are ventricular tachycardia and ventricular fibrillation. If not treated, the chances of recovery of such a victim is highly unlikely. After completion of 5 cycles of 30:2 in a 2 minutes interval, we must check for the pulse. If the pulse returns or the victim becomes responsive, we must put the patient in a recovery position. If the patient doesn't gain consciousness or the pulse doesn't appear, we must continue CPR till the help arrives.